So keep in mind, I'm a mother of 3. I had just finished reading this book the night before to my son. So maybe not what you want to do in a job interview. So on to the next question. How might I apply this to my role? I'm getting somewhere with this. So as the story unfolds, glad to share it with you, you learn about Flick, who is an inventor, a technology entrepreneur, the type of smart people that I get to work with every day. And for Flick, rather than just continue to do the same thing and work harder with little result, he decided to find a way to work smarter. So he overcame obstacles, even when others didn't believe he could do it. So in the end, he shared his new invention, a grain harvesting contraption, I think I saw my John Deere person there, with the entire ant colony benefiting from his effort. So in a way, he demonstrated the determination it takes to be a successful entrepreneur. So I keep this book in my office to remind me of the importance of invention and innovation and the talent, energy, and courage that it takes to make a big difference for the greater good. So these are traits that I see in Aaron. And Aaron Lazarus serves as the Chief Executive Officer for Untitled Therapies. He manages all business operations, and he provides a vision for the future of the company. He previously served as project manager for the lead generation program at Patient Star. And after Aaron completed his BS in biology in 2014 from Wake Forest University, he then pursued his MA in management, graduating in 2015, the same year he started the company. Is that correct? Right. So my organization, the North Carolina Biotechnology Center, recently announced a $65,000 loan award to help support the company's work. And this work is very important because right now at this time, there's no prevention therapeutics currently on the market after 30 years of research. So as Aaron will tell you, it's been a challenging journey, especially related to being a young entrepreneur seeking to raise very significant capital and money required in the biotech industry. However, you will soon learn why Aaron and his team are determined to solve an enormous problem around drug addiction. So join me in welcoming Aaron.
Hold on one sec, I'll get the slideshow set up. Okay, that looks good. I'm Aaron Lazarus. Nancy, thanks for the introduction. Russ and SciTech, thanks for having me to speak with you today. So I'm going to share a little bit about our story and talk about this great unmet need of substance abuse and what our company, Neurotherapeutics, is trying to do to stop it. So really, we started the company, and the goal of it is to change the lives of those suffering from substance use and mental health disorders. And the tagline we gave for the title of this talk is really the mission and the goal is to break the cycle of addiction using next generation neurotherapeutics. And, so really how we started, we were just a couple of graduate students at Wake Forest, and we got an opportunity to learn about entrepreneurship as well as biotechnology in a challenge called the Neuro Startup Challenge. And we started working. We brought upon the co-founders and then a couple of advisors. We started off learning the process, coming up with a business plan and elevator pitch, and see what we could do around trying to come up with a company around specific NIH technology. And through the time of developing it, we really stumbled upon this great unmet need of substance abuse. And it also came through some personal loss through the team itself. And we saw that 24 million Americans in this country suffer from substance abuse. And to go even deeper, 5 million are suffering from cocaine and methamphetamine addictions. I feel like everyone in this room may know, well, either has suffered themselves or knows someone who has suffered from a substance use disorder. And you could see the challenges that they're struggling with to overcome that disease. We had a friend in college that sadly passed away, but he tried to go to rehab. He tried to recover from substance use, and it's so difficult, especially with little to no effective treatments. But on economics, from an economic side, substance use has led to a $700 billion loss of productivity in this country. And the big reason for all of this is the lack of FDA-approved treatments to treat people. There's only a handful available, and there's currently none available for cocaine and methamphetamine addictions. So really what we were trying to do, we saw that there's these new and exciting innovative approaches that are coming out of academia. So from the government like the NIH or academic institutions across the country are inventing new and exciting ways to treat substance abuse. However, we've seen that pharma has sort of are a little bit wary of taking them up, and they're reluctant to do so for a couple of reasons. One has to do with the wariness that comes with the substance use space. Nancy mentioned that it's been 30 years. They've been trying to develop a treatment for cocaine and methamphetamine for 30 years with no success. It comes with old societal views that we view on addiction. For a while we've seen that that it's more of a human failing than it is more of a disease. And then there's other reasons that pharma is reluctant to assess them. Mainly it's their own sort of strategic shift away from the early development space. So this graph really shows where they're strategically placing themselves right now in the drug development pipeline. So drug development is an 8 to 15 year process. It costs about over $1 billion. Drugs that start in this drug discovery phase on the left have maybe a 10% chance of actually succeeding. So pharma basically realized that they can make much more money by moving away from this traditional drug development approach and just focus on the later stage clinical trials, and then build up their portfolios by licensing in or acquiring exciting compounds from small biotech. So this is sort of the reason why we created Encephial Therapeutics. We wanted to propel innovative biomedical discoveries into next generation neurotherapeutics. So really the goal is to identify those promising compounds from academia, accelerate them through our company, and I'll say how we're going to do that in a minute, and then out-license them to a strategic pharmaceutical partner when we show proof of concept. This gives us the advantage of focusing on the science. We're mostly scientists on the team, as well as doing it in a shorter period of time. So really the goal of trying to establish this accelerated pipeline is to engage in academic institutions, collaborate with private companies, foundations, but it's mainly the academic institutions. I like to tell the story all the time of how we were trying to see what testing we should do for our first compound, and we went to a CRO and see, do you guys do these tests that are specific for drug addiction? And I think we bounced off of 5 different CROs, and none of them were able to do it. And it really highlights that the experts when it comes to developing treatments for substance abuse aren't found at private companies. They aren't found at pharma. They're found in academia in this early development space. So it's really important, and really the goal is to collaborate with these institutions. And currently we're collaborating with the National Institute on Drug Abuse, which is a subset of the NIH, as well as Wake Forest, who is one of the strongest in the country in addiction pharmacology. On the strategic pharmaceutical partner side, normally, as I mentioned, it's been historically small, and this still has to do with that moral failing that comes with people suffering from substance abuse. But we've seen this changing landscape over the years that comes with treating addiction. Just to name some examples that highlight this, the DSM-5, which is the standard diagnosing manual for brain disorders, now lists addiction as a treatable mental disorder. And this opens the door academically and scientifically for trying to develop treatments for addiction. On a political side, the Affordable Care Act now mandates that all addiction treatments have to be covered by insurance companies. There's also an expansion of Medicaid to give coverage to more lower income people, a lot of whom are suffering from substance abuse, as well as decriminalization of certain drugs. Is another sign of moving towards treatment. And what all this means is that this gives us a new opportunity to find that pharmaceutical partner at the end. So what we're starting with first is the NIH has granted us an exclusive license to investigate and test a library of modafinil analogs to become the first FDA-approved treatments for cocaine and methamphetamine. Now, this is a $35 billion substance abuse market, and this gives us the chance to come in with a new groundbreaking solution. Before I go into what our solution is, I want to show what's being done for cocaine and methamphetamine as a whole. Currently, what people are getting who are suffering from cocaine and methamphetamine addiction are going in for more psychological behavioral therapies. The big one is cognitive behavioral therapy. The idea is basically to try to change the thoughts of the individual, and then hopefully that will lead to the behavior to follow. There's also some off-label treatments that are being done. Adderall, Ritalin, and modafinil are three of the ones that are sometimes prescribed off-label, but they haven't been shown clinically to work. There are some current treatments that are in development currently. The one we highlight is Embarra Neurotherapeutics. They're in their phase 2 trials, and they've received a good amount of money, grant money from the NIH. But there's certain indications that may not work. They're really targeting the anxiety and stress level attributed to cocaine addiction. And they're breaking down into some secondary targets. They're also real focused on nicotine as well. And this really highlights that the big problem with coming up with a treatment for cocaine addiction. There's a cycle that comes when people are addicted, and you can target with a certain pharmacotherapy one, maybe two of these areas of the cycle, but you're not going to be able to target all of them. And we don't think that there may be this ideal cocaine pharmacotherapy or this magic bullet treatment, which highlights really going back to that collaborative approach that we're trying to go after. We really want to collaborate with all these individuals in this space because that's the best way we're going to come up with treatments for people addicted to cocaine. To go into the history of how we've tried to develop treatments for cocaine, Nancy mentioned it's been 30 years trying and failing, and some of the success in this industry has come with developing therapeutics that have positive reinforcement. And some of the best examples of that are, you look at methadone or Suboxone for heroin addiction. The problem with those drugs are the same problems with those trying to develop for cocaine addiction, maybe if not more. It's the fact that they're addictive themselves. You're just basically trying to trade one addiction for another. And part of the reason is that cocaine, mechanism of action, it binds to this transporter in the brain called the dopamine transporter. And this is responsible for bringing dopamine back into your nerve cells so it can be stored. When cocaine blocks it, it keeps cocaine in your system for longer, and it brings you that euphoric feeling. So when designing a positive reinforcing treatment, you need to hit the dopamine transporter, but not hit those abuse liability effects. So that's really what's been happening at the NIH with Dr. Amy Newman. She discovered that there's these types of compounds that bind to the dopamine transporter in a different way than cocaine. It changes the conformation different than cocaine and some of these other stimulants do. And this could be a way for having this non-addictive side by keeping the efficacy. One of those compounds is an FDA-approved drug for narcolepsy called modafinil. These compounds that we've licensed are chemically tailored for cocaine addiction from modafinil, and I'm going to go and explain why we needed to do that. So in 2004, the University of Pennsylvania tried to test in humans, does modafinil curb cocaine addiction? And they've been getting mixed results ever since that test in 2004. And the main reason for this is that modafinil is pretty non-selective for that dopamine transporter, as well as it binds to many different sites in the brain. So it's not only weak, but it's also pretty non-selective. So Dr. Amy Newman at the NIH tried to develop these chemically derived analogs from modafinil. And you can see the lead compound here, JJC8016, is slightly modified from it. And basically, they're combined to increase that efficacy, but keeping that same abuse liability. I'm going to show you how that looks in these two slides. So for the efficacy, how animal models for testing cocaine addiction are done are through these models called self-administration, where cocaine-addicted rodents are placed in the boxes, and they're trained to press levers, where one lever will give them cocaine, while another one will give them food or water. And what you're trying to do is one set of animals is a control group, one set of animals is the treatment group, and you want to see in the treatment group that they're pressing the lever for cocaine less. And that's what we're seeing in this data. So this data here is showing that JJC8016 is having less lever presses than the control group. And it's even doing so better than modafinil, which shows significant data, but not as much as JJC8016. And what's even better with the improved efficacy, it keeps that same core structure for abuse liability and showing no real abuse liability here. So what this graph is showing is it's doing that same self-administration, but instead of training the rodents to press levers on cocaine, they are doing that in this group, but they're training them to press levers for JJC8016. And this is really showing the difference here. Rodents really want to press the lever for cocaine, but they don't really want to press it for JJC8016, which makes it seem like it's not going to be that addictive. But nevertheless, when we were looking at JJC8016, there were certain warnings, such as cardiotoxicity, that didn't really make it prudent for a drug candidate. So this really led to ourselves and Dr. Amy Newman to come up with a second generation of compounds. We're currently selected one lead so far, and we're gonna work with her to try to develop it, and this is how we're gonna do it. So essentially, this is what that slide about drug development comprised into our stages. So we anticipate 3 stages of doing it. In stage 1, we're going to be screening those drug candidates that we developed with Dr. Newman. We're going to be doing tests at Wake Forest as well as at NIDA, as well as a couple CROs, basically to test that efficacy, abuse liability, and early safety. And once we select one lead compound, we're going to move into the rest of the animal studies to secure an IND. Once the IND is secured, we're going to move into human clinical trials and basically try to find a safe dose in humans, and then try to see does this curb cocaine addiction in humans. And after which, we're going to out-license this drug to a strategic pharmaceutical partner. Just to go briefly into what our financials are looking like, we anticipate that through all these milestone and royalty payments that we anticipate receiving from a strategic pharmaceutical partner, for a first-in-class medication, we expect to potentially make $150 to $200 million just with the out-license over the period of time it gets through to commercialization. There are worst-case scenarios in case it fails after we out-license, but all of these are pretty much higher than our costs. We really anticipate spending about $15 to $20 million over the lifetime of the drug. We're currently in that stage 1 area, which I showed, and we're in the process of raising $800,000 to cover it. We've currently raised in non-dilutive funding about $500,000 from federal sources as well as state. Nancy mentioned that we just got this loan from the North Carolina Biotechnology Center, so we're happy to be a part of that team. But with a company, it's not just cocaine and methamphetamine that we're focused we want this long-term vision to try to treat all people that are suffering from substance use disorders that don't have an effective treatment. And this is really showing the long-term vision and what we're really targeting. For us, we want to look at those markets that don't have FDA-approved treatments. So while heroin and opioids are such a big thing in the population right now, there is methadone, Suboxone, and naltrexone that can help, that are very effective at helping people with opioids. Same with alcohol and tobacco, there are some effective drugs. For us, we want to target those people that don't have any effective treatments. And one of those things are people that are suffering from multiple addictions. There are many people in this country that are addicted to both cocaine and opioids, or both cocaine and alcohol. Many are addicted to nicotine and another drug. So it's coming up with a treatment responsible for helping both those people, both those indications. The other thing we're looking at are comorbid disease with mental health. What we've been seeing is that people suffering from mental health disorders, that feeds on their substance abuse. And then in turn, their substance abuse will feed on their mental health. And this just ends up in this downward cycle, and it doesn't seem like they can get out. So coming up with effective treatment that targets both is critical. The other areas, there's a lot of babies that are born from drug-addicted mothers that may lack have cognitive impairments. So we want to help develop treatments for that. And then last are just overall cognitive decline that comes from substance abuse. So that's really what we're doing. I'd like to thank you all for listening to my presentation. If you have any questions, please.
Any questions? Nobody else is curious? Hold on. Wait a minute, excuse me. Everybody.
Great talk, by the way.
Thank you.
You mentioned helping babies born to mothers, I guess, who are addicted. Is the treatment that you're currently pursuing for the mother, for the baby, for both? How will you work that out?
Yeah, so for the treatment that we're developing now, the first things we're going to be looking at are cocaine and methamphetamine. And that's what the data is showing. It's really just an overall, people that are trying to quit cocaine and methamphetamine, let's give them treatment. For these compounds, I think that would help for the mother, obviously. A mother trying to quit, this would be a good drug for her to take. We also want to look at the child too, because there's significant cognitive loss that comes from babies that are born. So I'm not sure. We would have to start doing research with these compounds to see if they would work. They probably weren't designed for that. Maybe some other drug in the library could work for that, but we'd have to see.
Hello, my name is Frances, and really nice presentation you
Yeah.
have. I was wondering, you were talking about when moms are addicted. What about when it's just the dad and not the mom? That the boy can have any issues after they burn or something? Or is just when he's the mom is the addicted one? Or
I'm not sure how much research comes if the father contributes to any sort of addictive levels. I think on a genetic level they might. It's something we may look at like a genetics. We want to look at the genetic side. If that plays a part in helping us with clinical trials, we would want to look at that. I think this comes from like a development standpoint. This is a really new topic that we may be targeting, and it comes from in the development process of a child. And a mother's addicted, taking cocaine while pregnant, I think that can lead to cognitive decline in a child that's born.
Aaron, nice talk.
Thanks.
Being a former CEO of a small molecule pharmaceutical company, I've been in your position many times. So I have a question for you. The statistics for opioid-related deaths in Forsyth County are really high,
Mm-hmm.
and actually, it's the highest county of the 12 counties in the triad. Do you have any comment on that?
Yeah, I heard that too in the news, and obviously the opioid crisis is big. I think, I think the opioids, there are effective treatments, and I think in order to work with opioids, I think we need to connect people to those effective treatments, which would be Suboxone, making sure that, you know, emergency services have naloxone for overdoses. Cocaine and methamphetamine are on the rise too. I'm not sure what the numbers are looking like in this county, but I just had a conversation today with the inventor that the numbers for cocaine and methamphetamine are on the rise. And with these people, there isn't an effective treatment for them, and that's really what we want to target. It's not that we're ignoring the opioid crowd. We think that providing a new pharmacotherapy for substance abuse will help all who are addicted.
Any further questions? I would like to hear from Nancy. Oh, okay. I'm sorry.
I just wanted to ask do you know how long someone might have to be on this medication?
Yeah. So since there are no approved for cocaine, we can't be sure. We just could base it off of what's being done currently for opioids. And that can last up to, it could be real quick depending on the person, or it could be like 6 months as a short period, or up to a year. Usually with heroin, there's like 3 stages where they're given buprenorphine or Suboxone like daily to try to help with the withdrawal effects. Then it's sort of lessened, combined, going to psychiatrists to go with the cognitive behavioral therapy, and then it's lessened even more, trying to get it in a downturn. We probably would model it similar to that, but right now, on a clinical standpoint, we're probably looking at just running like a 8 to 12 week trial to make sure that it works. But it could be different depending on what it is, but we'll probably merit it off of opioids.
Aaron, I have a question for you. As I look around this room, there's a lot of youth.
Mm-hmm.
As I look at you, I know that you are somewhat of an outlier. You are a young man trying to do something really big, and I commend you for that. Can you talk a little bit about just a personal reflection on what was your moment in time? You mentioned about a friend, about where you saw an opportunity to come and take the lead and do something as audacious as starting a company right when you were graduating from college, because I really want you to help inspire the next generation of individuals that if they dream it, they can do it. And I think you have smart people in this room because it's a beautiful day outside and you've chosen to be here. So could you, not to put too much pressure,
No.
but just reflect and speak from the heart, because I think what you say could influence and inspire someone in this room to go do something as great as this. Thanks.
Yeah. So when I was in college, I immediately knew that I wanted to do something in science, whether it was biology or chemistry. Going into college, I knew. I grew up with it. My parents are both doctors. It's what I didn't know if I wanted to be a doctor, but it was science. I definitely wanted to do science. And I got to my senior year of college, and I've done research in a lab. I've worked and shadowed doctors to try to figure out if that's what I want to do. And I could see with my parents with medical school that, and being doctors, that they loved what they did. And I never really fell in love with that. And I could tell that I would have to love it to put in all that work. And it was the same thing with graduate school, where I didn't really want to spend my life sitting at a bench all day. And I was just sort of stuck in college, just trying to figure out, what do I do? And usually we're told early on that there's these set paths you have to take, where, you know, if you're a science major, you have to go to get your PhD, or you have to go to medical school, or if you're a political science major, you have to go to law school. If you're in business school, you have to work for a big company. And that's not really true. I find that we all really take different paths, and you never know what's going to come. It's okay to take something different. When I was in business school, I stumbled upon this, and it was a personal motivation just for the loss. It was the opportunity to try to help people, but in reality, it was something I loved. I generally loved what I was doing. I loved building a company. I loved pitching it to people. I loved all the nature of drug development and trying to help people. And that's really what led me down this path. So advice that I could give, don't feel pressured that you have to go down this path because that's what everyone is telling you to do. Find what you love and just do it and work hard doing it.
I have something from Nancy. Would like to say something?
I won't keep y'all long, but that's a great segue. I don't know how many of you know this gentleman, Russ Reed. Russ has been a leader across the state and has really helped put the Piedmont Triad on the map around growth in the biotech industry. Outside of RTP, this region of the state has the highest concentration of life science activity, very diverse. And so this office, our headquarters is in RTP, and this office opened as the first statewide office. And Russ was a part of that, and he has served on our advisory committee in a variety of different roles for a very long time. Just this past spring, we held an event called Triad BioNight, and we were fortunate enough to have Dave King, the CEO and chairman of LabCorp, speak. But the reason I'm setting the stage for that is in order to really throw a big party, how many of y'all have thrown a big party? And a celebration of awards, you need to raise some money. And so Russ stepped up, and he was unable to make our last regional advisory meeting. And he stepped up and led a group of our advisory committee members to raise in less than a month over $60,000 for an event. And so I just wanted to present him with this plaque publicly, and I hope you all will share in my enthusiasm. If you need someone to raise the money for something that's meaningful, here's your man. So, and there's also some adult refreshments in a bag for you, but nonetheless, this is from the chair of our advisory committee is actually the chief financial officer of Piedmont Pharmaceuticals, Piedmont Animal Health in Greensboro. But this is a certificate of appreciation for outstanding performance and lasting contribution as team leader for sponsorship for Triad BioNight 2017, which was held on March the 30th of 2017. So thank you, Russ.
Well, thank you, Nancy. Total surprise. Never expected that in a million years, and it was always a pleasure to work on Triad BioNight. And I hope some of these people in this room in the future will be able to have an opportunity to attend Triad BioNight. And I want to thank the North Carolina Biotech Center for its sponsorship this year of SciTech Lecture Series. Really appreciate that, and that's how we're able to give a nice framed certificate like this to Aaron Lazarus. So Aaron, please, on behalf of the college, on behalf of North Carolina Biotech Center, our partners Bio Network, thank you very much, and obviously the foundation helps us here at Foresight Tech too. And may I tell you, from one ex-CEO to another, that was a great lecture.
Thanks, Russ.
So that concludes, but what we like to do sometimes is with SciTech, we have a 8 or 9 year tradition now of you having a chance to come up and speak with the speaker. And I'd encourage you to do that. And also, we like to take photographs. So if you'd like to come up and talk with Aaron, please do. If you're not too hurried to get out and enjoy the beautiful day. It's a pretty important subject. So please come on up. And faculty, I want to get a quick picture with Aaron so that we can put that up on, what do we call it, Tech Talk or something? Or Tech Link, yeah.